As we approach the festive season, we've made a short video to reflect on everything that has been achieved this year and to say the most enormous thank you. Despite the pressures that we faced during the coronavirus pandemic and the demand for our services at a level that we've never experienced before, we've managed to make fantastic improvements. Those improvements have only been made by the sheer hard work, dedication and commitment of staff and teams right across our trust. That dedication and commitment has been recognised through all sorts of awards that have been won, both at regional and national level. And in our staff awards, over 500 teams and individuals were recognised and nominated. And what a fantastic evening we had. So on behalf of the board, I am incredibly proud of everything that has been achieved, and we cannot say a big enough thank you. Let's now watch this short video and celebrate the achievements you have all made. Thank you. We joined the biggest vaccination programme in NHS history. We opened a vaccine hub in just 1 week. People from right across the trust put themselves forward to help. They gave up their much needed days off, their evenings and weekends to help us vaccinate as many people as possible. We also introduced 7-day working, where staff again volunteered to work across 7 days, evenings and weekends to really benefit service users and carers. We increased our bed capacity by working with partners. It was really important to make sure we could support the ever-increasing demand on our services. Our community teams supported a significant increase in the number of people ending their lives in their homes, again working in partnership. We used technology in ways we've never done before. Our Attend Anywhere programme helped us to stay in touch with service users at a time when we could no longer meet face to face. Last year, it helped us carry out 65,000 video consultations. We opened up mental health urgent assessment centres, working in partnership with our acute trusts, to enable anyone with urgent mental health needs to be seen in a safe and calm assessment space. We now have 5 of these across the region. We started Family Hour, reaching over 20,000 people, including supporting people's well-being, mental health and parenting amongst other areas. This resulted in Sam Tyra, our fantastic lead, receiving the Prime Minister's Point of Light Award. We also launched a 24/7 crisis line, which meant our trained professionals could be on hand to provide immediate assistance to anyone who needed it, a real lifeline to those who used it. We also opened the long COVID referral hub for people who've had long-term effects of the virus. And for all those helping others, staff who work across our system, across all of the public sector, we opened a resilience hub supporting people who had mental health needs. April 2021 saw the launch of our new locality structure. Our new networks working across the Bay, Fylde, Pennine, Central and West Lancashire, and our new specialist services network. We invested significantly in clinical leadership, and we're now working even more effectively with our partners to enable people to have joined up seamless care within our communities. Our ambition is that people receive high quality care no matter where they live in Lancashire and South Cumbria, and we're making some great progress. Our mental health services have really worked hard and made great improvements, with 99% of people seen in A&E within 4 hours and 92% seen in 1 hour. Throughout the year, we've worked closely with system partners and have developed new models of care. We have our new initial response service. We've also invested significantly in community and primary care, mental health services, again very closely working with partners, including the voluntary sector. And we're starting to develop new models of provider collaboration, where we have great ambitions to improve local community health. An unannounced CQC inspection in the harbour in April told us we'd made some great improvements across our adult wards and our psychiatric intensive care units. We've got more to do in those wards and in our older adult wards, but it's great to see a direction of travel showing improvement. Our improvement collaborative work has shown a significant reduction in the number of falls and the number of restraints across some of our inpatient areas. We've seen some great results from this improvement work, including a reduction in long waits in A&Es, reduction in people being seen in LSCft suites, a reduction in the length of stay for inpatients, and a reduction in people having to be treated out of area. We've invested significantly in staffing in both our inpatient areas and our community areas in combination and partnership with our commissioners and partners. Additional funding was vital during the year for our community learning disability services, and we were delighted to receive over £2 million of funding. The money has helped us improve also our community autism services, again a really important service for those who need it. Our efforts were recognised nationally by being shortlisted for 4 Health Service Journal Awards. Better still, the My Place project went on to win the Mental Health Innovation of the Year award. Just brilliant. Plus, our use of technology to improve patient experience with mental health services was highly commended in the awards. In 2020, we continue to prioritise listening to people who use our services, their families and their carers. We use this feedback to continuously learn and improve. Our new Service User and Carer Council has enabled service users and carers to start to influence and shape the way we develop our plans and the decisions we make across our trust. And despite the backdrop of the pandemic and the demand on services, the number of complaints during the year fell by a great 42%. Not only that, but we received 5 compliments to every 1 complaint. Our children's inpatient services achieved the QNIC accreditation in recognition of the high standards of care they deliver. Improving our culture has been a very high priority for us. We continue to champion the development of a more inclusive workplace that promotes and values diversity. We've set up our Inclusion Council and staff networks to represent our minority ethnic or LGBTQ colleagues, women and our colleagues with a disability. The COVID Equality, Diversity and Inclusion Group was set up to look at risks presented by the pandemic and how we could particularly support our minority ethnic staff. We were delighted that our workforce race equality standards had shown significant improvement in 7 out of 9 indicators. We commissioned an independent race equality review to support us to develop an improvement plan that eliminates racism and discrimination across our trust and makes sure that diversity and inclusion is at the core of our culture. We know that none of the changes we need to make will work unless we have the right culture in place, and we've got significant work happening right across the trust to support this. Our Listening into Action programme saw staff come forward with ideas on how we can continue our improvement journey. We had a whole range of themes with big conversations and staff leading improvement areas, including the development of a just culture, person-centred care and flexible working. We showed just how much we valued staff by giving them a voucher during the year for them to spend on their health and well-being. Staff told us they felt really appreciated and enjoyed spending the vouchers, treating themselves, their families and their loved ones. Our staff survey showed improvement in all 10 themes, and we were included in the top 10 most improved mental health trusts nationally. And to think all this is just the very tip of the iceberg. It's incredible to reflect on what we have achieved in the last 12 months. This is all built on a willingness and enthusiasm to provide the highest possible levels of care. And despite what we've faced, that momentum just grows and grows. Wow, and to think that was literally the tip of the iceberg. Thank you to everybody that's been part of our improvement journey. Thank you to our service users and carers, to governors, to our partners, but most of all, a massive thank you to our staff. Your hard work and resilience this past year really has been incredible. Thank you to those of you that are giving up time with your loved ones over the festive period to keep our services going, those services that really will be a need to many people in our communities. Although we faced challenges no one could have perceived or foreseen in the last 12 months, your determination and resilience has pushed us forward, and I know we're going to see the same over the next 12 months. So to end this short video, thank you, thank you, thank you, and hoping everybody, even in a small way, has some rest and time to refresh over the festive season.